always been more interested in health, having a healthy mouth than cosmetic looks of things. And based on an examination, I knew that my mouth wasn't as good as it could be, and the best option was an implant.
I decided to have dental implants because I had 2 huge gaps on this side of my mouth, and I was putting a lot of pressure on the other side, and some of my teeth started to have a problem.
I felt really involved in looking at the treatment plan. First of all, I'd never heard of a treatment plan before. I just received whatever was thought necessary, but to be consulted, given the options, and I think there were 3 or 4 options that I could have chosen, and then under no pressure, just given the time to think it out. And what I did was to talk to my wife about it, and she said, which one did I want to go for? I told her, she said, go for it, and that was the implant option. Boy, I'm glad I did it.
There were lots of options given to me, and I was told about bridges, about false teeth, about implants, and I was given the positives and the negative sides of it. And eventually, after me asking lots and lots of questions and being told lots of information, maybe 2 or 3 visits later, because I was still having some other work done, I decided that the best option was to have implants.
So yeah, I had more than enough information. I was absolutely certain by the end of it.
It was amazing. Both my husband and myself had implants. I had 3 and he had 1. We'd been told, both of us, that we should take a paracetamol if we had any pain. He took one thinking he probably would have, but afterwards realised that he hadn't had any pain. And I had 3 when I had mine done, and I can honestly say that the next morning it was absolutely fine. I was quite shocked that it was fine, because I did expect it to be sore, but it really wasn't sore at all.
It was not in the slightest painful. I think the thought that you might possibly cause me pain caused you pain, but I didn't feel any at all. It's brilliant. First of all, I feel more confident. I've been self-conscious since the age of 9 when I had my front teeth knocked out, and I've worn dentures ever since. Now, I don't think about having anything unusual at the front of my mouth, so I'm less self-conscious. And I know that friends and family have said to me that they think something's different about me, but they're not quite sure what it is. And then, of course, I tell them, well, I've had this implant surgery. I'm delighted with it. Also, sometimes when you eat with a denture, no matter how sort of conscious you are, the denture moves with the food. That's never going to happen with an implant. So it's better all round. It's excellent.